Senator McDonald, you are welcome to open on LR 397.
Thank you. Again, my name's Mike McDonald. I represent LD5 South Omaha. I'm here to introduce Legislative Resolution 397. The purpose of LR 397 is to examine the needs in the current state of Nebraska's mental health system. This includes the workforce and funding streams for the mental health across Nebraska. Experiencing a global pandemic has shined a light on mental health care, and I believe somewhat dissipated the negative stigma related to mental health. With more awareness on mental health, now is the time to examine our commitment to mental health care funding, needs, and workforce across the state. This is an issue that impacts all Nebraskans and all levels of government across our state. We need to collaborate with our counties, schools, providers, regions, DHHS, and others to make sure we are all pulling in the right direction to tackle the mental health needs and care for Nebraska. Just want to thank you for being here today, and the people behind me that will be testifying, they are subject matter experts. As we all know, we probably have a friend, a family member, a neighbor that is struggling with mental health, and I think it's our responsibility as senators to try to bring people together, which you will hear different people, as I mentioned, behind me today, but at all levels of government, to work together to try to solve this issue.
Next call on a representative from the Nebraska Hospital Association.
Good afternoon, Mr. Chairman and members of the Health and Human Services Committee. I am Jeremy Nordquist, President of the Nebraska Hospital Association, and here today representing our 92 member hospitals across the state of Nebraska. I was here last Friday and we discussed post-acute placement challenges that our hospitals were seeing, and this hearing today certainly ties in, as behavioral health is a significant barrier to moving patients out of the hospital to the appropriate level of care. Our hospitals, Nebraska hospitals, often serve as the front door to needed behavioral health services for Nebraskans. Over the last 12 months, and I've provided a handout, there have been over 34,000 behavioral health visits to the emergency room, or about 93 a day, every single day throughout the year. And in the handout, you can go in a little greater detail about the specific categories of patients for the reason. The overall number is up slightly from the previous year, although the number of patients who have then gone from the emergency room to inpatient admissions has come down just a little bit. And if you're interested in longer term data on that front, we're happy to provide that to you. But these individuals enter through our emergency rooms when they cannot access or are not accepted into community services, and I think the hearing you heard before certainly is a pathway to addressing the shortages of community services throughout the state. For patients needing inpatient care, wait times in our emergency departments can be extensive. One system reported delays of over 72 hours in the emergency room for about 10% of the behavioral health patients coming through the door. Another health system reported that their average can be up to 19 hours, and that's the average number for patients sitting in their emergency departments. Obviously, lack of inpatient beds is a significant concern. One of the issues that we would like to look at and take on in the next session is the reimbursement for inpatient beds. I've handed out an example from Bryan Medical Center looking at their inpatient and outpatient costs versus reimbursement for inpatient and outpatient beds. But just going back from 2020, 21, and 2022, if you look on the back on the chart side rather than the graph side of that handout, you'll see that total cost per cases went up 2% in 2020, 13% in 2021, and 10% in 2022, all while reimbursement per case went down 5% in 2020, went up 5% in 2021, but then down another percent in 2022. And that leaves you that gap on the front that, as you can see from the blue line, doesn't even cover the variable cost per case, let alone the total cost per case for inpatient visits. So that's an issue that is important to our hospitals that provide inpatient psychiatric care and is essential for us to build the inpatient capacity that we need. Another major concern we hear about from our members is the lack of capacity at the Lincoln Regional Center, adding to these delays. According to the Department of Health and Human Services, the average wait time right now at the Lincoln Regional Center is 83 days for those that ultimately get admitted. And often this can be a challenge on the back end too. If a patient does get discharged from the Lincoln Regional Center, but their symptoms worsen, maybe their commitment has been dropped, there aren't beds available at the Lincoln Regional Center for them to go back to if their situation gets worse. And often then they're stabilized at our hospitals and waiting for very extended periods of time to find appropriate placement. And then just wanted to circle back to an issue we talked about last week, and that was on post-acute placement and the specialty units for skilled nursing, long-term care, but in particular for behavioral health patients. We know that we have a high number of these patients sitting in our hospitals waiting for care, but again, it's very challenging to send behavioral health patients to nursing facilities that aren't designed to care for them. They don't need inpatient care, but they certainly need the appropriate psych care. And we need to look at models to create those specialized units of post-acute care that also meet their behavioral health needs. So happy to answer any questions, or if the committee, as they dig deeper into this, would be interested in additional cuts of information from our hospitals, we're happy to provide that.
Good afternoon, Chairman Arch and member of the Health and Human Services Committee. My name is Marianne Borgeson. I have proudly served on the Douglas County Board of Commissioners since 1995. I currently serve as chairwoman of the Douglas County Board and of our Region 6 Governing Board. At the Douglas County Correctional Center, there are currently 1,303 incarcerated individuals, and the average daily population is 1,130. Of that population, we had 929 incarcerated individuals diagnosed with mental illness, which equates to a 41.9% of our jail population with mental illness. You can compare that to November of 2021, where we had 901 incarcerated individuals with mental illness at a 38.03% rate of population with mental illness.